a framework for understanding and healing depression. A strengths-based biopsychosocial spiritual approach. Learning objectives. In this module, you will learn how to define depression through a holistic and clinical lens. Apply strengths-based assessment strategies to uncover resilience factors. Identify biological, psychological, social, and environmental contributors to depression. Integrate naturopathic and evidence-based interventions that support recovery and long-term wellness. Let's get started. Understanding depression. Depression is not a single cause or condition, but a syndrome of interconnected symptoms that can vary in form, duration, and intensity. Diagnosis typically depends on a cluster of symptoms that reflect disturbances across emotional, cognitive, physical, and social dimensions. Contributing factors. Common influences. Emotional influences. Anger, grief, anxiety, guilt, shame, and so forth. Cognitive influences. Negative thinking patterns, cognitive distortions, self-criticism. Relational influences. Unhealthy dynamics, lack of belonging, dependence on external validation. Physical influences. Neurochemical imbalances, poor nutrition, sleep disruption, or side effects from medication and other drug use. Environmental influences. Trauma exposure such as abuse, chronic stress for instance, in the work or home environment, socioeconomic hardship such as student debt and academic pressure leading to burnout or employment and financial stress, or lack of restorative spaces, for instance, living in areas with pollution, noise, or environmental degradation and radiation poison. Poor access to natural light or outdoor recreation. Strengths-based assessment. A holistic, strengths-based approach focuses on what's working, not just what's wrong. Encourage curiosity, critical thinking, empowerment, and resilience by asking questions such as, which symptoms feel most difficult right now? What strategies or supports have helped, even a little? When was the last time you felt better, and what was different then? What would life look like if depression were no longer in control? Encourage clients to notice both what worsens and what improves their mood, identifying patterns of resilience that can guide treatment. Neurobiological factors. Key neurotransmitters. Serotonin, dopamine, and norepinephrine regulate motivation, concentration, pleasure, energy, sleep, and help to relieve pain. Neurotransmitters and the role of exercise in healing depression. Supportive interventions. Improving sleep hygiene and circadian rhythm balance is one of the most powerful and often underestimated ways to heal depression and restore emotional stability. Depression and disrupted sleep are deeply interconnected. Up to 90% of individuals with depression experience some form of sleep disturbance, either insomnia, hypersomnia, sleeping too much, or irregular sleep patterns. Poor sleep doesn't just result from depression. It can cause or worsen it by disrupting the brain's neurochemical balance, emotional regulation, and stress response systems. Restoring sleep hygiene and circadian rhythm is not a luxury. It's a biological necessity for emotional healing. Neurotransmitter regulation. Sleep helps restore optimal levels of serotonin, dopamine, and norepinephrine, chemicals vital for mood, motivation, and focus. Biological mechanisms. Without enough quality sleep, serotonin and dopamine drop, increasing irritability, fatigue, and hopelessness. Cortisol and stress. Poor or irregular sleep elevates cortisol, the stress hormone, keeping the nervous system in a chronic fight-or-flight state. Over time, this suppresses immune function, depletes energy, and impairs emotional resilience. Circadian rhythm alignment. The circadian rhythm, the body's internal 24-hour clock, regulates sleep, hormone secretion, digestion, and body temperature. Misalignment, from late nights, irregular schedules, or artificial light exposure, confuses these systems, leading to low mood, brain fog, and metabolic imbalance. 2 psychological and emotional benefits. Improved emotional regulation. Deep sleep, especially REM, allows the brain to process emotional experiences and reduce reactivity. Without REM, emotional memories remain unprocessed, fueling anxiety, guilt, or grief cycles. Cognitive clarity. Address chronic pain and stress, healing depression by addressing pain, chronic stress, and supporting neurotransmission. Support neurotransmission through nutrition, hydration, and exercise. Incorporate mindfulness-based relaxation and stress reduction. Hormonal factors. Thyroid, estrogen, testosterone, cortisol, and DHEA all influence energy, libido, cognition, and mood. Imbalances may mimic or worsen depressive symptoms. Balanced hormone function is essential for emotional stability, energy, and mental health. Naturally supporting hormones like estrogen, testosterone, and DHEA can help restore mood and motivation without medication. Estrogen can be balanced through phytoestrogen-rich foods, such as flax seeds, soy, and chickpeas, along with cruciferous vegetables that support hormone metabolism. Testosterone production improves with zinc and magnesium from foods like pumpkin seeds and spinach, as well as strength training and vitamin D. Cortisol, the stress hormone, can be regulated by mindfulness, adequate sleep, and balanced nutrition, which help calm the nervous system and restore circadian rhythm. DHEA levels rise naturally with regular exercise, healthy fats, and adaptogenic herbs such as ginseng or schisandra. In essence, nutrition, movement, rest, and stress management work together to harmonize the body's natural hormone balance, supporting both mental and physical resilience. Naturopathic strategies include comprehensive lab testing and physical evaluation, anti-inflammatory, nutrient-dense nutrition, regular movement and sleep-wake routines, stress management and mindfulness practices. Pain and somatic factors. Chronic pain often reinforces depression. Holistic interventions may include movement therapies, yoga, tai chi, PT, guided imagery, meditation or hypnosis, hydrotherapy, TENS, massage or acupressure, cognitive reframing to disrupt the pain catastrophizing loop. Emotional processing. Common emotional drivers of depression include anger, guilt, jealousy, anxiety, and grief. When someone consistently experiences emotional invalidation, criticism, rejection, or restriction of self-expression, it can create a deep sense of shame, helplessness, or unworthiness. Over time, these experiences can condition the nervous system to associate self-expression or authenticity with danger or punishment, leading to emotional suppression and low self-esteem, both strong risk factors for depression. Therapeutic focus. Identify triggers and create de-escalation plans. Journal and reframe toward self-growth. Facilitate emotional processing and reconciliation to promote self-compassion and resolve relational or internal conflicts. Gradually confront feared or avoided situations while identifying and practicing effective coping strategies to reduce anxiety and build resilience. Acknowledge and process personal or relational losses while developing rituals or practices that foster meaning, acceptance, and emotional integration. Cognitive dimensions. Depression often persists through maladaptive thinking patterns such as catastrophizing, all-or-nothing thinking, and overgeneralization. Holistic cognitive interventions. Use mindfulness-based CBT techniques to cultivate present moment awareness, recognize unhelpful thought patterns, and develop cognitive and emotional flexibility. Practice self-compassion and use positive affirmations to challenge and reframe negative self-talk, fostering emotional resilience and self-acceptance. Use narrative or journaling techniques to explore personal stories, reframe experiences, and cultivate new, empowering perspectives. Address relational stressors and environmental triggers to strengthen support, safety, and emotional resilience. Unhealthy or high-stress relationships can amplify shame and isolation, while connection serves as a protective factor. Design a low-stress zone in your home to establish mindful autonomy. Incorporate lifestyle interventions to support depression recovery, including nature exposure, mindfulness or meditation practices, and regular physical or recreational activities. Begin your transformation today and receive a free ebook on recoding subconscious beliefs at liberatedliving.com. Explore 40+ fully accredited holistic diploma programs, liberatedliving.com programs. Apply as a holistic professional, liberatedliving.com application for professionals. Save more. Take 25% off when you subscribe, or become a VIP member and enjoy 50% off exclusive rates with an annual $75 membership. Join at liberatedliving.com/loyalty. Each program includes professional online training, an internationally accredited diploma, a comprehensive therapy workbook, and a turnkey business model designed for immediate practice success. Our flexible learning pathways empower practitioners to launch fulfilling careers while working remotely from anywhere in the world. We hope you found today's production valuable. At Liberated Learning, you can pursue internationally accredited certifications in over 40 holistic wellness programs, offering pathways to provider licensing, board certification, and continuing education, CEU PDUs. To explore the full range of programs, visit holisticschool.online or follow the link provided.